A shortage of healthcare professionals in rural areas is not anything new. But according to the USDA, between 2005 and 2023, 146 rural hospitals either stopped providing inpatient services or closed completely. It's an issue that's still impacting those who live in the tri-states. And for residents in Ottumwa, Iowa, their options are about to shrink even further. Our anchor and reporter Elizabeth Shores spoke with a patient whose clinic is about to close.
When this photo of Bobby Preston and her son was taken, Preston didn't know yet just how many health complications she would experience in the coming years. She'd always had health issues, but she'd never known the extent of them.
After I got married, I had good health care finally, and we started digging.
That digging revealed a genetic kidney issue, brain disease, degenerative disc disease, lung problems, and more. Issues large hospitals like the University of Texas Medical Branch in Galveston had trouble diagnosing and treating. She says even the Mayo Clinic stopped providing care for her.
I've always said, when one organ fails, they all follow.
Preston's been dealing with those complications for the past 22 years. In 2022, her husband's job required them to move to the Ottumwa area. Moving to a smaller city meant fewer healthcare options, and the few that were available didn't necessarily want to treat Preston. She already had a team of specialists in Iowa City and was looking for a new primary care doctor to handle things like medication refills or to see when she'd get sick.
I had two of them tell me, we're not qualified. There's just no way we could treat you. We're not qualified. Down here it really does affect you because you don't have any options. And when you do have options, they take them away.
It took her nearly a year to find a new doctor. She picked a provider at MercyOne in Ottumwa, where she lives, and has been seeing him for 2 years. But now that MercyOne is closing on February 27th, she'll have to decide if she'll travel to see her current doctor or to just head straight to her specialist team. She first heard about the clinic's pending closure while she was at the chiropractor's office.
I said, you have got to be kidding me. Receiving the information I received the day after they were notified they were closing was just pure devastating. I came home and cried. And I said, well, what do we do now?
She remembers walking into the clinic after that appointment.
The total atmosphere in there had just totally changed. You knew something was going on. It was quiet. Nobody was talking.
She says clinic staff only officially notified her of the closing and that they would be unable to keep her scheduled March appointment on February 10th. She said she's also limited to whatever practices are covered by her insurance company. Between healthcare expenses, insurance, and Medicare coverage and the distance between her home and her providers, Preston says she feels stuck.
I get asked by every single doctor I've ever met, how do you do it? What's kept you going? I said, well, up until my son turned 18, it was my son. But now I don't know.
One of Preston's specialists wants to get her on a list for a double lung transplant. Her health issues make her feel even more stuck.
I can't hardly travel anymore because they give me oxygen, but they give me a battery that lasts an hour. And each battery is $700. I can't fly because I got to have oxygen to fly. I got to have oxygen to exercise. I mean, if I'm at rest, I'm fine. But the minute I get up on my feet, I'm supposed to have oxygen on.
Still, Preston says she's more concerned about how the clinic's closure will affect the elderly, who may not have as much support as she does. She says life would be a lot less stressful if she had more healthcare options, and says that's probably the case for others in the community.
I mean, how many of us are without? There's not enough doctors in this community. There's not.
In Ottumwa, I'm Elizabeth Shores reporting.
Now, Preston says if her current provider moves too far away, she'll skip a primary care doctor altogether and head straight to her team of specialists in Iowa City. She gives herself 2 hours to get there since her health conditions make her stop frequently.